Every year, more than 1 billion routine blood tests are conducted globally. Every single one of them is evaluated once and then discarded. Modern medicine evaluates tests by comparing your result, that blue dot, against a static population average. If it drops 14%, it may stay inside that bracket, appearing healthy. But a flashing red bracket reveals you lost your personal baseline. By treating blood tests as isolated snapshots, we miss the actual trajectory of a patient's health. There is a 3 to 5 year window where cancer establishes itself metabolically before becoming structurally visible, and those discarded results already contain the evidence needed to see it. Warning signs for these metabolic diseases rarely appear overnight. They have been quietly accumulating in your past medical records for years, hidden in plain sight. The barrier is how that data is stored. It is trapped in a fragmented graveyard of physical paper printouts, forgotten PDF files, and photos buried in chat history. To catch early metabolic changes, we have to process this legacy data and reconstruct a patient's historical trajectory. This is where a multimodal vision AI called Gemma 4E4B enters the picture. It is designed to run directly on your smartphone using light RT, completely independent of an internet connection. You photograph any lab report from any country, and the AI instantly extracts the unstructured data. It automatically translates differing medical units, like milligrams per deciliter, into millimoles per liter, aligning everything into a single, clean format. Because all of this processing happens locally on your device, zero patient data is ever transmitted to the cloud. Your medical history stays entirely on your phone. This animation shows what the system does with that extracted data. The AI takes those scattered, disparate data points from your past and weaves them into a smooth, tightly constrained trend line over time. This establishes your true, personalized biological envelope. The AI vision converts these dead paper records into a living, personalized mathematical foundation, perfectly ready for predictive analysis. With your baseline established, the system calculates biological velocity, the specific rate at which different markers in your blood are changing over time. The first graph curves upward, tracking the Warburg effect, velocity of your shift toward rapid glucose consumption. The second tracks biological age acceleration. The third tracks immune ratio collapse. Together, they merge into one unified indicator, the Trident Signal. Cancer cannot fake all three of these independent biological processes simultaneously. When they accelerate together against your personal baseline, it provides a specific metabolic pattern that warrants immediate clinical review. Consider Priya. She is healthy, experiencing no symptoms, living her normal daily life in that silent window, completely unaware of the internal biological shifts happening inside her. For 4 years, her doctor looks at her isolated annual blood tests and declares them normal. But in the background, all three of her metabolic velocities cross the danger threshold at the exact same time. This triggers Protocol 99. A larger Gemma 4 AI activates in a secure cloud enclave. It reviews her history to rule out transient illnesses or medications, and generates this structured oncologist-ready clinical dossier. The AI acts as a triage filter. Instead of alarming Priya with a sudden diagnosis, it translates raw anomaly data into a professional request for human medical evaluation. Driven by that AI dossier, Priya's oncologist orders an ultrasound and detects stage 1 ovarian cancer, a stage that carries a 93% survival rate. This chart compares her outcome with the old snapshot system. Without the AI tracking her velocity, her cancer would have likely gone unnoticed until it became symptomatic at stage 3, where the survival rate plummets to 29%. This level of predictive insight requires no new physical sensors. You already own the necessary hardware in your pocket, and the vital data is already in your possession. By finally reading the history we already possess, patients are no longer passive subjects in a medical system. They become active owners of their own biological survival.